Right now, before I say another word, I want you to do something. Find a mirror or use the camera on your phone and take a really good look at your eyes. Look at the whites, look at the colored part, the iris, look at your eyelids, the skin around your eyes, and notice how your eyes feel and how well you're seeing. Because your eyes are far more than the windows to your soul, they are one of the few places in your entire body where a doctor or you can directly see your blood vessels, your nerves, and the effects of your overall health right there on the surface. And your eyes can quietly reveal warnings about your heart, your circulation, your blood sugar, your cholesterol, your thyroid, your liver, and your brain, often before you'd notice anything anywhere else. And here's what I want you to understand today. Many of the changes you'll see in your eyes after 60 are completely ordinary and harmless, just part of getting older, and I'll reassure you clearly about those. But a few eye signs, and I'll be honest with you about exactly which ones, can be an early warning of something in your body that genuinely deserves attention, and one or two of them are true emergencies where every minute counts, and knowing them could save your sight or even your life. So, today I'm going to walk you through what your eyes are trying to tell you, one sign at a time. I'll tell you which changes are nothing to worry about, and which ones you should never ignore. And there's one particular eye sign near the end, one that comes on suddenly, that you must treat as an emergency, so whatever you do, don't stop watching before we get to that. Keep looking at your eyes as we go, and let's read them together. Let me first explain why your eyes reveal so much, because once you understand this, all the signs make sense. Your eyes are richly supplied with tiny, delicate blood vessels and nerves, and they're one of the only places where these can be seen directly, without any cutting or scanning. So, conditions that affect your blood vessels throughout your body, like high blood pressure, diabetes, and high cholesterol, leave visible traces in and around your eyes. Your eyes are also affected by the state of your blood, your organs like your liver and thyroid, and even your brain and nerves, since seeing itself is a function of the brain. And because you use your eyes every waking moment, changes in how you see, or how they look and feel, are often noticed early. So, your eyes are like a clear window onto your circulation, your nerves, and your general health, if only you know how to read what you see. Now, let me show you the signs, starting with one about the color of the whites. The first sign is yellowing of the whites of your eyes. Look at the whites of your eyes. They should be white, perhaps with a few tiny visible vessels. But if the whites have taken on a yellowish tinge, that is worth paying real attention to. Because yellowing of the whites of the eyes, called jaundice, can be a sign that there's a problem with your liver or with the flow of bile, or occasionally with the breakdown of your blood. The yellow color comes from a substance called bilirubin building up in the body, and the whites of the eyes are often where it shows first, before the skin. Now, a slight yellowish or fatty appearance of the whites can also come from harmless age-related changes, but a genuine spreading yellowing, especially with other symptoms like dark urine, pale stools, itching, tiredness, or a yellow tint to the skin, is a reason to see your doctor without delay, because it points to the liver. So, yellow whites are one of the clearest signals your eyes can give that something inside, especially your liver, needs checking. And the next sign is about a ring you might see, which means different things at different ages. The second sign is a gray or white ring around the colored part of your eye. Look closely at your iris, the colored part. Do you see a pale gray, white, or bluish ring or arc around its outer edge? This is very common in older adults, and it has a name, arcus senilis. And here's the reassuring part. In someone over 60, this ring is usually a normal, harmless part of aging, caused by a bit of fatty material depositing at the edge of the cornea, and it does not affect your vision. So if you're older and you notice this ring, it's usually nothing to worry about. But here's the interesting twist. In a younger person, say under 45, that same ring can be a sign of high cholesterol. So it's more meaningful the younger you are. So in your later years, that gray ring is usually just a harmless sign of age. And I mention it mainly because so many people notice it and worry unnecessarily. But the next sign, involving your eyelids, is a genuine cholesterol clue at any age. So look carefully. The third sign is yellowish bumps or patches on your eyelids. Look at the skin of your eyelids, especially near the inner corners, up by your nose. Do you see soft, yellowish, slightly raised bumps or patches? These have a name, xanthelasma, and they're worth knowing about because they're deposits of cholesterol under the skin, and they can be a sign that your cholesterol or other blood fats are high, which matters for your heart and your arteries. They're harmless in themselves, and some people have them without high cholesterol, but they're a genuine reason to have your cholesterol checked because they can be an outward visible sign of what's happening in your arteries. So, those soft yellow patches on your eyelids aren't just a cosmetic quirk. They can be your body flagging your cholesterol, and they're worth a mention to your doctor and a simple blood test. Now, let me talk about redness, because a bloodshot eye alarms people, and I want to reassure you about the common kind. The fourth sign is a red bloodshot eye. Now, general redness of the eyes is often just dryness, tiredness, or irritation, and is usually harmless. But sometimes you'll look in the mirror and see a striking, solid patch of bright red on the white of one eye, as if it's filled with blood in one area. This looks frightening, but here's the reassurance. This is usually a harmless burst of a tiny blood vessel on the surface, called a subconjunctival hemorrhage, and it typically clears on its own over a week or two, much like a bruise, without affecting your vision. It can happen from a cough, a sneeze, a strain, or for no clear reason. So, a dramatic red patch on the white of the eye is usually nothing dangerous. However, I'll add this, if these bursts happen repeatedly, it can occasionally be worth checking your blood pressure, or, if you're on blood thinners, mentioning to your doctor. So, a one-off red patch is usually harmless, but repeated ones are worth a conversation. And now we move to how your eyes feel, and then to the most important signs of all, so stay with me. The fifth sign is dry, gritty, or watery eyes. Do your eyes feel dry, gritty, sandy, or as if there's something in them? Or do they water excessively, which is often the eyes overproducing tears in response to dryness? Dry eye is extremely common after 60, as we naturally produce fewer and lower quality tears with age, and it's usually more of a nuisance than a danger, easily helped with lubricating drops and simple measures. But it's worth knowing that persistent dry eye can sometimes be linked to other things, certain medications, thyroid problems, or conditions affecting the body's moisture-producing glands. So if it's severe or comes with dry mouth or other symptoms, it's worth mentioning. So dry, gritty eyes are usually just an ordinary, manageable part of aging, but severe or symptom-accompanied dryness can occasionally point to something more. Now, we come to the most important area of all, your actual vision, and the signs you must never ignore. So, please pay close attention to these next parts. The sixth sign is changes in your vision itself, and this is where the truly important conditions live. Now, some gradual change in vision is normal with age, needing reading glasses, or finding you need more light. But certain vision changes are your eyes warning you of conditions that can steal your sight if not caught, and after 60 these become far more common. Gradually clouding, blurring, or dimming vision, with glare and halos around lights, can be cataracts, a clouding of the lens that's very common and very treatable. A gradual loss of your side vision, often unnoticed until advanced, can be glaucoma, a serious condition of pressure in the eye that can cause irreversible blindness but is treatable if caught, which is exactly why regular eye exams matter so much, because glaucoma is often silent. Blurred or distorted central vision, where straight lines look wavy or there's a blur in the center of what you look at, can be macular degeneration, a leading cause of vision loss in older adults. And if you have diabetes, changes in vision can signal diabetic damage to the retina, which is why people with diabetes need regular eye checks. So gradual vision changes are not just about needing new glasses. They can be your eyes revealing cataracts, glaucoma, macular degeneration, or diabetic damage, all of which are far better caught early. And this leads me to the signs you must never, ever ignore, the emergencies. So here they are. The seventh sign, and the one I most want you to remember, is any sudden change in your vision, because that is an emergency. Everything I've described so far tends to come on gradually. But if you experience a sudden loss of vision in one or both eyes, a sudden blurring, a sudden dark curtain or shadow coming down or across your vision, a sudden shower of new floaters, those specks or cobwebs drifting across your sight, especially with flashes of light or sudden double vision, you must treat that as an emergency and seek immediate medical help. Here's why. A sudden shower of floaters and flashes, or a curtain coming across your vision can be a retina detaching, which can permanently destroy sight in that eye if not treated quickly. A sudden painless loss of vision can signal a blocked blood vessel in the eye, which can be the eye's version of a stroke, and can even be a warning of a stroke affecting the brain. And sudden vision loss with other symptoms like weakness, drooping face, slurred speech, or severe headache can be a stroke. So burn this into your memory. Sudden vision changes, a curtain, a burst of floaters and flashes, or sudden loss are never to be watched and waited on. They are reasons to seek emergency care immediately, because fast treatment can save your sight and sometimes far more. Now, let me quickly cover a couple more. Then what to do. Let me mention a few more briefly. A drooping eyelid that comes on gradually is often just an age-related change and usually harmless. But a suddenly drooping eyelid, especially with double vision, a severe headache, or other symptoms, can signal a nerve problem or stroke and needs urgent attention. Bulging or protruding eyes, or a persistent staring appearance, can be a sign of thyroid problems, particularly an overactive thyroid, and are worth checking. Persistently puffy, swollen eyelids can come from fluid retention, allergies, thyroid, or occasionally kidney problems. And a new difference in the size of your two pupils, especially if sudden or with other symptoms, needs prompt attention. So, the general rule with your eyes is this. Gradual, both-sided, painless changes are often ordinary, but sudden changes, one-sided changes, and changes with other symptoms are the ones that demand urgent attention. Now, let me pull this together into what you should actually do, because protecting your eyes and reading their signals is genuinely within your power. First, and most importantly, have regular eye examinations, because a proper eye exam is one of the most valuable health checks there is. An eye doctor can detect glaucoma, cataracts, macular degeneration, and diabetic changes early, often before you notice anything, and can even spot signs of high blood pressure, diabetes, and other conditions in the blood vessels of your eyes. Regular eye exams after 60 are not optional. They're one of the best things you can do. Second, protect your eyes from the sun with sunglasses that block ultraviolet light, since sun exposure contributes to cataracts and other damage. Third, manage the big conditions that harm your eyes. Keep your blood pressure, blood sugar, and cholesterol well controlled, and don't smoke, since smoking genuinely harms the eyes and raises the risk of macular degeneration. Fourth, eat a healthy diet rich in fruits and vegetables, which supports eye health, and stay generally healthy and active. Fifth, use lubricating drops and simple measures for dry eyes, and rest your eyes during close work. Sixth, know your family history, since conditions like glaucoma and macular degeneration can run in families, which your eye doctor should know. And seventh, and above all, act promptly on the warning signs. Never ignore sudden vision changes, and get gradual changes checked too. So regular eye exams, sun protection, managing your blood pressure, blood sugar, and cholesterol, not smoking, a healthy diet, and prompt attention to changes, together these protect both your sight and, through your eyes, your wider health. Now, let me be very clear about when your eyes are a reason to see your doctor, because this is the part to remember. Seek emergency care immediately for any sudden vision change, sudden loss of vision, a curtain or shadow across your sight, a sudden shower of floaters with flashes, sudden double vision, or a suddenly drooping eyelid, and especially if any of these come with weakness, facial drooping, slurred speech, or severe headache, since these can signal a detaching retina, a blocked eye vessel, or a stroke. See your doctor promptly for yellowing of the whites of your eyes, which can point to the liver, and for gradual vision changes, blurring, side vision loss, distortion, or dimming, which can signal cataracts, glaucoma, macular degeneration, or diabetic damage. See your doctor about yellow cholesterol patches on your eyelids, bulging eyes, persistent puffy eyelids, or repeated burst blood vessels. And have regular eye exams even if all seems well, because the most dangerous eye conditions are often silent. So sudden changes are emergencies, and yellow whites, gradual vision changes, and the other signs warrant seeing your doctor, while regular exams catch what you can't feel. Let me leave you with a picture of why this matters. Picture a man in his 70s who, one evening, suddenly notices a shower of new floaters drifting across the vision in one eye, followed by flashes of light, and then a shadow beginning to creep across the edge of his sight. He could easily have told himself it was nothing and gone to bed. But because he knows that a sudden burst of floaters and flashes with a shadow can mean the retina is detaching, and that it's an emergency, he seeks help immediately, and because he's treated quickly, his sight is saved when waiting even a day might have cost him the eye. That one piece of knowledge, and the willingness to act fast rather than wait, made all the difference. That is exactly what learning to read your eyes can do for you. And let me speak briefly to those of you caring for or close to an older person. You can help by encouraging regular eye exams, which catch so much early, and by taking seriously any mention of vision changes, especially sudden ones, and getting emergency help without delay for a sudden loss of vision, a curtain, or a shower of floaters and flashes. You can watch for yellowing of the whites, which can signal the liver, for cholesterol patches on the eyelids, and for signs like bulging eyes. And you can support the measures that protect the eyes, managing blood pressure, blood sugar, and cholesterol, not smoking, and sun protection. Helping a loved one look after and read their eyes can protect their precious sight and catch important conditions early. Let me draw this all together. Your eyes are one of the clearest windows onto your inner health, directly showing your blood vessels, your nerves, and the effects of your circulation, blood sugar, cholesterol, liver, and thyroid. Most changes after 60, the harmless gray ring, a one-off red patch, ordinary dry eyes, are nothing to fear. But some are genuine warnings: yellow whites pointing to the liver, cholesterol patches on the eyelids, and gradual vision changes signaling cataracts, glaucoma, macular degeneration, or diabetes, and above all, any sudden vision change is an emergency. So here's what I'll leave you with. First, understand that your eyes reveal your inner health, and that most age-related changes are harmless, so let those reassure you. Second, learn the signs that matter: yellow whites, eyelid cholesterol patches, and gradual vision loss. Third, and most important, treat any sudden vision change, a curtain, a burst of floaters and flashes, or sudden loss as an emergency and seek help immediately. Fourth, have regular eye exams even when all seems well, because glaucoma and other sight-stealing conditions are often silent. And protect your eyes with sun protection and by managing your blood pressure, blood sugar, and cholesterol, and not smoking. And fifth, act promptly on changes rather than waiting and hoping, because with the eyes, early truly can mean the difference between saving and losing your sight. Your eyes are quietly telling their story every day, and most of it is reassuring, but a part of it deserves your attention, and now you know how to read it. So take care of yourself, protect and check those precious eyes, and act on the signs that call for it. And because diagnosing and treating eye and health conditions needs a professional's judgment, please treat sudden vision changes as an emergency, and yellow whites or gradual vision changes as your reason to see your doctor or eye specialist, rather than ignoring what your eyes are trying to tell you. If this helped, please give it a like and subscribe, because I share this kind of clear, practical guidance for older adults every week, and I'd love for you to keep watching with me.